Santa Clarita's hometown station, KHTS. I am Kyle Jennings. Appreciate you hanging out with us for the City of Hope Hour on your hometown station, KHTS. Go to cityofhope.org/Santa Clarita to learn more, or keep listening because we're going to continue to talk about the awesome facility. It's right out there on Valencia Boulevard, right across from City Hall. Top floor on that building next to that Bank of America. So that's where you're going to find City of Hope. And I hope I don't overstep by saying this, but you guys can go check it out. Just listeners can go
absolutely
hop by and say hello.
Find me and I'll give you a tour.
Yeah, there you go. Find Amanda and you'll be fine. And so pretty state of the art facilities here, right here in the Santa Clarita Valley, which it's good for a town like Santa Clarita because we're kind of it seems not that far from Los Angeles where all the heavy hitters are and stuff. But depending on traffic, it could take 40 minutes or 4 hours to get down to Los Angeles. So it's really nice to have a facility like this here in the Santa Clarita Valley with doctors and employees that work and live here in the Santa Clarita Valley that care about this town. And it's just a really great thing that the City of Hope is able to be here in the Santa Clarita Valley. So go to cityofhope.org/Santa Clarita and learn about all of their facilities and everything they have to offer, including urological things.
Oncology.
I should say oncology?
In general.
Any urological services.
Any urological services. So let's get into that. Dr. Wittig is here. You can learn more about her. You have your own little URL too. cityofhope.org/clinical-trials is what you have. Oh, I'm sorry. cityofhope.org/Christina-Wittig. Mm-hmm. So you can learn more about your background as well, which we went over in the first half of the show. But I wanted to ask you, for those who don't know, what is the study, like urology? What is urology?
So it's basically any surgical diseases or even some medical treatments for anything afflicting kidney, bladder, prostate, testicle, penis, and those pretty much all the urological organs.
Okay. And how common are different diseases with relation to urology?
There's prostate cancer, bladder cancer, kidney cancer. Those are, I guess, the most common things that we see. Sorry. And then there's a lot of benign conditions of the kidneys and prostate, like enlarged prostate, kidney stones. There's incontinence, urinary tract infections. Okay. Those are the most common things. So we see and deal with all of them.
Okay, and so you don't just deal with, and that being said, you personally don't just deal with oncology. You deal with all urological diseases, right?
Correct.
Okay. Mm-hmm. So what are some of the, let's start with preventative stuff. Mm-hmm. What are some of the preventative stuff that people can do to make sure that everything is working the way it should with that part of your body?
Well, number one thing, smoking cessation. It's a big risk factor for bladder cancer, as well as many other cancers.
Did you say smoking? Did you say smoking?
I did.
Okay. Every single doctor I've had in here, no matter what they've talked about, they've said don't smoke, and so don't smoke. That's what I'm trying to say. And so you're saying smoking it leads to urological diseases as well.
Correct.
So every part of the body it'll affect.
Mm-hmm. And bladder cancer, it's one of the main risk factors for bladder cancer is smoking.
Really? Mm-hmm. That's crazy. Well, it's not crazy, but it makes perfect sense. But what's crazy is people still smoke. That's the weirdest thing to me. But okay, so no smoking. What are some other preventative stuff that we can do?
I would say the main thing is there's not much else you can do, I guess, to prevent things like prostate cancer, kidney cancer, besides just, general healthy lifestyle. But there's not much you can do, to modify your risk factors. But the main thing, if you feel any signs or symptoms that are not normal, just go see your primary care, who can refer you to a urologist if they feel it's a concern. And it's the same with any non-cancerous conditions too. So if you're starting getting things like not urinating, feel like you're not emptying your bladder well, or the stream is really slow or not normal for you, then you can just go have it checked out, make sure there's no underlying issue that needs to be addressed right away. If you see blood in the urine, that's something you need to see your primary right away and get referred to a urologist. And those are the main things. So if something doesn't feel right, or if there's some kind of lesion somewhere, that doesn't look right, you just go see a urologist, because that could be also cancerous. So even though penile cancer is very rare, but we still do see it, and that's not something you want to ignore. So
yeah. Again, we're speaking with Christina Wittig on your Dr. Christina Wittig on your hometown station KHTS. This is the City of Hope show. Go to cityofhope.org/Santa Clarita. So in terms of diet, is there any dietary things you would say? You said, you kind of mentioned it, like just living a healthy lifestyle, which, in this internet age, people pretty much should know what a healthy lifestyle is, and but that's a whole nother conversation. But is there dietary things that can help or hurt somebody with regard to urology?
Well, with kidney stones, number one thing, you have to make sure you're drinking plenty of fluids, especially living in this area. It's very hot in the summer and dry, so a lot of kidney stones. So drinking a lot of fluids, staying hydrated is number one from that standpoint. And of course, just general heart healthy type of diet is good for, any kind of condition. Not just the urological condition. Yeah.
I've heard this, and help me dispel this or reinforce it, that drinking a lot of soda is bad for. It can help create kidney stones. Is that true?
So definitely, soda, things with artificial colorings are not good. And then you also don't get very hydrated when you drink soda. So we say water should be your mainstay drink to hydrate. But also, you can have soda once in a while, but you should at least have plenty of water to go along with it. So. Yeah. And
are kidney stones something that can happen in anybody? Is it like a genetic thing? How
it depends. Some families have kidney stones, but some could be isolated where you the only one in your family has a kidney stone. So there's some genetic ones, but those are more not as common.
This is a selfish question, because my grandfather and my father both had kidney stones, so it's a totally selfish question.
Yeah, it's and that's something that I wouldn't recommend screening for sure, because it's not like there's a direct link, right? Or if you have somebody in the family has it, you should get checked out. It's just one of those things. If you get symptoms from it, then that's how we usually diagnose it. Yeah.
Is there certain, in terms of preventative, is there certain, should you get a physical, or are there ways to detect? Because it seems like and correct me if I'm wrong, for urological problems, it seems like you won't really notice it until something is different than what it.
That's true. Yeah, the only cancer you can screen for is prostate cancer with a PSA test. And
what's a PSA test?
It's basically it's a blood test that they check for. It's called prostate-specific antigen in the blood, and if it's elevated, it could be indicative of prostate cancer. Certainly, other things like enlarged prostate, infection, urinary retention can also cause elevated PSA, but those are things that we have to sort out.
So for men, that happens. Unless you have a history around age 50, right? That's when you're going to start looking for prostate
50, 55, and it depends. If you have a family history, then you want to start earlier. If you don't, then usually about 55 is when we start screening. I think the new recommendations came out to be 55.
Okay. So I don't know, maybe I'll ask you this. What are one of the cancers that you're seeing a lot of, or maybe some of the urological diseases that you see a lot of that may be common, that we can help maybe ease some worries of people in terms of what you guys do for treatment of a certain disease. So which one would you want to focus on for maybe a common one? I know prostate cancer is certainly pretty prevalent. I don't know if there's another specific one that you had in mind that you see a lot of.
I mean, I'm biased. I see a lot of all types of cancers.
Yeah.
So, and again, there's a whole spectrum of prostate cancer. There's the kind of low grade versus high grade, and the treatment is completely different. Same
Yeah.
thing for bladder cancer. There's low grade versus high grade, and then high grade has its variants. So it's this whole different gamut of things that you can end up with. But I think the most common things for people, things like enlarged prostate, very common, especially you get older, the prostate gets bigger, and you start. Some people don't have any symptoms from having an enlarged prostate, and then you don't have to do anything about it. You just leave it alone, just because it's enlarged, but you don't have any symptoms.
Yeah.
You don't need to do anything about it. But if you have symptoms, that's when we have to start worrying that, are you emptying your bladder well? Is there other things going on? And that's when we start investigating into other things. And then same thing for women, the overactive bladder, and then the incontinence, recurrent infections. Those are the things that we certainly can. I think especially recurrent infections is one of those things that, there's certain regimens that we can use to help women who suffer from those, as well as incontinence, overactive bladder. There's medications that we can use to treat it. So I think it's definitely worth seeing a urologist to see if we can help with those issues.
So at what point do you guys, so what's the process here? Let's start with, let's just say an inflamed prostate or oversized prostate. Do you guys, at what point, what are the first couple steps that you guys take before hopping into surgery?
So I usually say, and if you have symptoms where you're getting up twice a night, but a gentleman will tell me, I don't mind getting up twice a night. I'd rather get up twice a night than take a medication. I'm like, well, that's up to you, because the medication is just for symptom relief. So we'll make sure he's emptying his bladder well with a little ultrasound. And if he's emptying his bladder well, there's no need to do anything about it if he's comfortable with that. But if he's not emptying the bladder well, or the symptoms are really bothersome, interfering with quality of life, then we start a medication. And there's 2 types of medications that we start for the prostate. And we start with one, and then if that's working somewhat but not enough, or it stops working, then we add another medication. So those are usually the basic things. And most of the people do well with just medications.
Okay.
And later on, if that doesn't work, then we can proceed to discussing surgical management, which is doing the roto-rooter, the kind of what people like to call it.
Yeah.
So basically going in there and cutting away excess prostate tissue.
Okay.
So those are very common procedures. And, the equipment we use right now is very, it's safe and not like back in, the olden days.
Are there any potential side effects with that?
There are side effects with everything.
Yeah. I'm sorry, yeah.
But if it's done right, you shouldn't have really much, side effects from it.
Okay, so just healing up.
Exactly.
Is the main thing there.
Yeah.
Okay, what about for women? You said incontinence and
recurrent infections.
Yeah,
those are the most common things.
Okay, so what about those? Once we figure out what's going on there, what could it be, and how do we treat it?
So it depends on the type of incontinence versus if it's overactive bladder type of incontinence, where it's urgency incontinence, or stress incontinence, where you cough, laugh, sneeze, and you leak. Those are different types. One is treated with either pelvic floor physical therapy if it's not as severe, or surgery, and the other one can be treated with medication versus minor surgeries like injecting Botox into bladder and things like that. So it's or sacral nerve stimulation. So those are if the symptoms are really bothersome. And I have some women come in and they say, I go to the bathroom every 30 minutes and I can't go anywhere. I can't do anything. I can't get on the plane. And that's, those medications can make a whole world of difference to them. So.
We're speaking with Christina Wittig, Dr. Christina Wittig, and she is the Assistant Clinical Professor, Division of Urological Oncology at City of Hope. And let's talk a little bit about oncology itself.
Mm-hmm.
You are a surgeon by trade, so what? I don't know. I'm trying to put people at ease because surgery is a scary thing. And what would you tell someone who is at City of Hope getting ready to do surgery on a cancerous part of? And I'm trying to figure out a way to say, it could be kidneys, bladder, any of those things. How would you put their mind at ease if they're about to, go under the knife, so to speak?
Well, I guess we do a lot of these procedures, so it's kind of commonplace. Nobody really gets excited about them. It's just all right, taking out another bladder or another prostate or another kidney. So it's just a routine for us, which is good. And for the patient, our team, it depends. Local hospitals, we're kind of trying to establish teams in place where we, the more these surgeries we do in the community, the more they're going to be used to doing this type of post-operative care, and that's our goal. But, for example, at City of Hope, our hospital, we have teams in place. It's a multidisciplinary team, so you have all different services available to you right away after surgery. They try to set you up for discharge with anything you can possibly need, and usually every hospital has that model, which is nice. And nurses already know after surgery how to take care of your particular condition, so it just makes it a lot easier for the patient afterwards, that they kind of everybody's on board with what they need. Makes them feel a lot better.
Yeah.
So I think knowing that people are comfortable with your situation kind of puts you at ease right away.
One thing that I really liked what you said about the reason you kind of got into urology was because of the patient follow-up. You got to have more patient interaction. So what that says to me is more, I mean, there could be surgeons that just want to get in there, do it, and then be done with it, which maybe, I don't know if that's the case. I'm sure maybe there's some surgeons like that. But with you, that part is, I think it makes you a better surgeon, and it makes you just a better caregiver in general. So that's important to emphasize there. But we're speaking with Dr. Christina Wittig. She is the Assistant Clinical Professor, Division of Urological Oncology, Department of Surgery at the City of Hope. Go to cityofhope.org/Santa Clarita. I wanted to ask you, Doc, how have you seen the... you haven't been doing this long. I know you say in 2008, it's not that long ago, or it seems like a century ago, but it's not that long. And so it's this tiny window of which you've done this in terms of the grand spectrum of things. But how have you seen things change with the way you do your job in the last, 9 years?
Well, I think mostly, we do see new treatments come out, especially recently prostate cancer, bladder cancer. We have new medications that got approved, which is great. We have the main thing, I think, is new technology that comes out. Even with a robot, we started out with one model. Now we have the new model come out, new instruments that are available for the Da Vinci robot, and just in general, even for small surgeries, just the new gadgets and instruments and things that are available make our life and patients' life a lot easier.
So you guys are working smarter, not harder, as it were, in some cases.
Yes, it definitely. There's less complications, and just makes the surgery go a lot easier.
With the robotics, is recovery time a lot less for the patients?
It is. Smaller incisions, less invasive, definitely faster recovery.
Okay. All right, cool. And again, we're speaking with Dr. Christina Wittig from City of Hope. And we're going to take a quick break. We're going to have some fun next, whether you like it or not. And it's going to be at your expense. So, but make sure you go to cityofhope.org/Santa Clarita. Amanda, you've been kind of quiet, so I just want to make sure that people know you're here.
Hi, guys. I missed you.
And I wanted to know, maybe just reiterate some of the things that City of Hope does here in the Santa Clarita Valley for those in need.
Yeah, absolutely. City of Hope is here providing services in medical oncology, general surgery and surgical oncology. We have a breast surgeon, gynecological surgeon, and urologist. We have, obviously, Dr. Wittig, but we also have a couple other urologists on site as well. We're here in the community to help the patients locally. That's a huge thing about us being here in Santa Clarita. If a patient is diagnosed here, they can stop by City of Hope. They can get referred from their primary care if they're on HMO and be treated in the community. They don't have to drive to Duarte. They don't have to drive anywhere for treatment. They can stay local. Our doctors are privileged at local hospitals, which makes that a lot easier on the patient as well.
Awesome.
Oh, yeah.
Awesome stuff. So go to cityofhope.org/Santa Clarita, or just stop by and look for Amanda.
I'll give you a tour.
And she'll give you a tour. If you just go, it's right across from City Hall on Valencia Boulevard, right next to that big Bank of America building. They're on the second floor over there at that medical building right next door. So make sure you go check it out. Or just go to cityofhope.org/Santa Clarita, and you can learn where they're located and all the services that they provide. And you can learn more about Dr. Wittig as well by going there. She's got a little profile on there and everything. We're going to take a quick break. We're going to wrap things up on the City of Hope show. This is your hometown station, KHTS. Santa Clarita's hometown station, KHTS. I am Kyle Jellings. Here on your hometown station, KHTS. This is the City of Hope show on your hometown station, and make sure you go to cityofhope.org/Santa Clarita to learn more. We've been speaking about pretty much urology is what we've spoken about with Dr. Christina Wittig, and we've learned some stuff. There's lots of treatments. There's lots of. We didn't really have time to go over all of the different things that you really treat. There's quite a bit of different. That's a lot of different things going on with the urological track. So, so there's a lot of stuff. But you not only are you doing oncology, but you also do any type of disease related to urological diseases. Right?
Yes, and it's also good to mention that we do have certain specialists, like we have Dr. Seth Cohen, who does just female pelvic floor surgery, and he's a specialist in incontinence and all different female pelvic floor disorders and all those issues. So he specifically did a fellowship in that field. So we have somebody who does urethral reconstruction and those types of disorders. We have Dr. Nick Warner, he does that. So we have different, if one of my partners doesn't do something, we have somebody else who does that specific. Yeah. Because we try to specialize. We try not to be too general, because certain things require extra training, and I feel like patients benefit from going to a person who specifically did that training. So. Gotcha.
Okay. Awesome. Again, go to cityofhope.org/Santa Clarita to learn more about all the services that they have to offer. And just find Amanda. Just go to the building and just go find Amanda. It's right across from City Hall on Valencia Boulevard, and she'll give you a tour and she'll answer all the questions you have, or she can point you in the right direction. I'm sure, right?
Yes.
Yeah. All right. Okay. So now it is time for now. Normally we do 5, but I'm just gonna ask you 4 questions.
Okay.
Okay. But this is the case. We're gonna have a little bit of fun here. All right. And so the first question is. This is just a little get to know you kind of questions. First question is. If you didn't have to sleep, what would you do with the extra time?
Do something for myself.
Okay.
Probably watch some TV.
So you just relax.
Yeah, go to the gym more frequently.
Okay.
Maybe go shopping.
Nice.
Things like that.
Okay.
And use extra time to catch up on all the paperwork.
So you have a lot of work to do.
There's not enough. Yes, there's not enough time in the day.
Okay. All right. What job would you be terrible at?
Well, sadly, pretty much I think everything except for being a physician.
You are doing what you were born to do.
Correct.
Yeah, and it's a good thing you found that out.
Yes.
It's a good thing you found that out. All right, what are some of the small things that make your day better? Just little small things.
I think just seeing how my patients feel better and are improved by the things that I'm treating, by the treatments that I propose. After surgery that I've done, I think that makes me very happy when sometimes even people send me cards, just thank you, and it just makes me feel better that what I'm doing is actually making a big difference, and that's very rewarding to me. Otherwise, of course, my kids.
Yeah.
And
they're literally small. They're just like small people.
It's small people, so they make me very happy, and my family.
Yeah.
So
not really a small thing, by the way. A successful surgery is not really a small thing that makes it, but it is a good thing.
Yes.
It is a good thing. Okay, what is something you consider to be a luxury, but you don't think you could live without?
So I don't think I can live without some kind of coffee drink, whether it be frappuccino or cappuccino from one of the coffee places, or pedicures. Those I don't.
Oh,
think I
there
can
it
live
is.
without. Yes, those 2 things I have to have.
I got a gift card for a pedicure, but I'm afraid to do it.
You should do it.
It's because I I don't know why. Actually.
No, you should just go for it.
I should
right? Just go. You love
I don't have to get them painted, right? That's not part of the thing.
It's required, actually.
Oh, is it really? Okay.
No.
Okay. All right. I'm thinking about doing it.
You can, but
I think I'm going to do it.
But I think you should do it.
I'm going to do it with my wife, so it's less like I'll say, oh, she made me do it, kind of a thing. But I really kind of want to do it.
I think you
So.
should just go by yourself and do it. That's it.
Just go by myself.
just just
maybe.
own it.
Yeah.
Just go.
Doctor, thank you for coming on. I really appreciate you being here. I appreciate what you do over there at City of Hope. And Amanda, always good to see you.
Good to see you too.
Thanks for stopping by. Go to cityofhope.org/Santa Clarita to learn more about City of Hope. That's located over there on Valencia Boulevard near City Hall, right across the street from City Hall, next to the big Bank of America building. Head over there. Second floor is the City of Hope, and go check out all the things that they have to offer online at cityofhope.org. This has been the City of Hope Show on your hometown station, KHTS.